Hey everybody, I am so excited. You guys don't even know. I am here with Caitlin Keller, and she is the owner of Unconstipated Kids. And so we're going to talk all about pediatric pelvic floor therapy and what services that Unconstipated Kids can help you with. Caitlin, thanks so much for joining us. Will you tell everybody in the YouTube universe what you do, who you serve, and how you can help their kiddos?
Hi, I'm very excited to be here. I'm excited to talk to you, Lauren. I'm excited to share about what I do because I find that so many families with kids that could benefit from some help don't know that these services exist. So I'm really glad for the ability to spread the word and the knowledge that services like what Unconstipated Kids provides is available to them. My name is Dr. Caitlin Keller. I have been working as a physical therapist and I've specialized in pediatrics since 2013. And then I've specialized in pelvic floor therapy since late 2014. So it's been a while. And then I established Unconstipated Kids in 2018 as a free blog, and it grew. And starting in 2020, I started taking clients officially and seeing families and helping them on an individual basis. Unconstipated Kids really just has a mission to serve families that need help with any kind of toileting, bowel and bladder symptom, challenge, hurdle that they're facing. And what I mean by that is not potty training. There are lots of different challenges that children can face, just like adults do, with their bowel and bladder functioning and their toileting habits and just their quality of life related to being able to do a skill that sometimes we take for granted. That's kind of a little summary of who I serve, really just families with kids that need some support with toileting health, bowel and bladder health, and achieving more independent success with those things.
Well, and I think I can probably speak for your families who've worked with you, but everyone who has not had the great gratitude to meet you yet is that Caitlin is just so personable. We were talking before we hit record for like 20 minutes just because, she is just so passionate about pediatric pelvic floor therapy. And also just knowing that she can help families all over the world. So that's one thing that is new with this interview is I'm so excited to share that Caitlin and Unconstipated Kids do virtual consults. So if you are listening to this interview and you're like, oh my gosh, but what if she's not in my area? I think Caitlin can also say that more and more pediatric pelvic floor therapy is becoming available, but it's still a very, very underserved niche in the greater pediatric physical therapy world. So, all mamas out there who are searching for answers in their own kiddos' pediatric pelvic floor health can breathe a sigh of relief right now because Caitlin is there for you no matter where in the world you are located. What are the
Mhm.
most common diagnoses or struggles that you see families come to you for?
The biggest one is functional constipation. So that just means constipation for an unknown reason, not a medical diagnosis, not something that your child was born with, but for whatever reason, your child is struggling to get stool out on a regular basis. So that's the number one diagnosis that I see. Families come with kids who they've tried to help through the potty training process, and now the child is 3 or 4 or 5 years old, and really potty training was never successful. And often it's because there's an underlying pelvic floor dysfunction or a muscle impairment or a muscle coordination challenge that pelvic floor therapy can work on. And then I see this other huge influx of kiddos that come in 8, 9, 10, 12 years old who are still having poop leaks in their underwear, who are still being challenged by nighttime bedwetting, that are still struggling with challenges related to poop. And they've been kind of suppressing them, dealing with them. Maybe those symptoms get a little bit better, maybe they get worse as the years go on. But they never seek out help until all of a sudden we hit this wall and there's an explosion of symptoms, like I said, close to that 10-year mark. That's one of the biggest things that I see help families with. Other diagnoses or symptoms that a child might have that a family comes seeking help from, the bedwetting challenges, which are often rooted in some kind of muscle coordination, global physical thing that physical therapy can help. Daytime leakage, a lot of urinary pee leaks during the day and poop leaks during the day. So those are all really obvious symptoms, right? If you hear unconstipated kid, you think, okay, poop, definitely problem. Um, but also urinary pee issues as well. But then there are the more subtle symptoms that oftentimes families don't necessarily think about, but that we can still absolutely help with. So things like reflux in infancy, vomiting, decreased appetite, challenges with growing, and just failure to thrive challenges. Because if you're very full of poop and you don't know it, you're going to have a decreased appetite. You're not going to want to eat,
Right.
and then you don't grow. And that can happen at any age. So those are things that we can definitely help with. I don't see a lot of them just because there's not a lot of awareness that pediatric pelvic health can help with those things. But one of my mottos in as a practitioner, but also in life, is it's always worth an evaluation. If you think that there's any possibility that a service might be helpful to you, whether it's pediatric pelvic floor or something else, it's always worth an evaluation just to check it out and see. So,
well, and I
those.
totally agree. I think the biggest thing that we shy away from maybe is the unknown. Like even when we're making an appointment for ourselves or we're making an appointment for our kiddos, a lot of times we're thinking like, well, if something is wrong, what is going to be required of me in order to fix this thing? And sometimes I think it's easier for us to take action if we really just look at an evaluation as, what can I learn in the time that I've already scheduled, that's already on my calendar? I know that this is a issue, or it may be an issue. Let me go to an expert, gather their knowledge, right? Pay them to like steal pieces of their brain that took them, 10 plus years, 13 years, or however long it's been since I graduated the same year as you. I don't really want to think about it. But like really gently dump all this knowledge into their brains. And now they're like, oh my gosh, I didn't know that this was connected to this, which was connected to this, which can influence this. And also the maybe unsure kind of nervousness you feel at the beginning of the appointment, really in anything, by the time you're through that appointment, you have that knowledge. Now you feel empowered. Now you know what you're, up against. Now you know that there's actually things you can do to influence this part of your body or this part of your child's body so that they can have a more enjoyable experience. Because I think, like we were talking about earlier, really having a gentle bathroom experience is a right for everyone to experience. And if it doesn't feel good on the inside because of tight muscles in your pelvic floor or constipation, or like you were mentioning, those muscles like turning on and off, they have to kind of sequence properly. And if there's like a traffic jam, for lack of better words, with that sequencing, that could be an issue. So all of these things are really a lot of times solvable with the right practitioner.
Yes, and I love that about my initial visits with families, walking them through the identification process of, this is what I'm seeing in your child. This is what I'm seeing as an area of potential improvement, and why it will help improve their toileting skills and their symptoms that they're experiencing. And then I give them a list of actionable steps to take to improve those areas. And then it makes it seem realistic and achievable.
Would you walk us through just what it would look like to be in person? Like, what does a therapy session look like? I think parents sometimes have a hard time trying to conceptualize. Like I see you have a poop emoji in the back. So obviously you're having all kinds of fun. But maybe just talk us through. I know I would love to hear about what it's like to come to your office.
Yes, that's a really big challenge that I've had is educating other providers about what pediatric pelvic floor therapy is, and then decreasing that fear of that families sometimes have of what this service might look like. Because most often we think of pelvic floor therapy, like I said earlier, for postpartum women after vaginal birth, and oftentimes that includes an internal assessment. I'm going to start right off the bat by saying that within pediatric pelvic floor therapy, there is absolutely zero internal assessment going on whatsoever. And so I think that providers that are aware of this type of therapy services need to know that. Families need to know that we're not doing an internal assessment on your child point blank. There is no exception for myself. I can't speak for other providers. However, I do also think that it's important to know the other things that we're working on. We do some specific toileting things. We do some time in the bathroom together, and your child may actually be sitting on the toilet during our session, and we're talking about different mechanics. But maybe we're also just sitting on a chair, and I call that mock toileting. We're sitting on a chair and we're practicing the mechanics of how to make their body work more effectively during toileting. And then other parts of the therapy look like regular developmental physical therapy services in pediatrics. So we're working on things like single limb hopping on one foot, and jumping jacks and skipping skills and backwards crawling, and strengthening skills, because all of the muscles within our abdomen and our pelvis and our hips and legs play a role in how our pelvic floor can function. And so if there's one group of muscles that are weak, there's very likely another group of muscles that is overcompensating. And so we want balance, especially if the pelvic floor is one of those two, if it's the weak group of muscles or the overcompensating group of muscles. Mm-hmm. Lots of strength building and muscle balance skills and coordinations. If one group of muscles has a challenge in terms of coordinating itself, and your child is 8 years old and can't do a jumping jack, then maybe their pelvic floor is also discoordinated. And so working on that jumping jack skill will overflow into improving their pelvic floor coordination. There may be times that we never talk about toileting, and that we're only working on skills related to gross motor, skipping, jumping, hopping, strengthening. And then other times, maybe we focus more on toileting skills. There's not really a sequence, right? We're not going through the same specific stuff every time. Just like with any other physical therapist, you change what you do within your session, and your home program changes, but lots of different options besides just laying on a table and doing internal work, because that's not even a part of our therapy at all.
No. Oh, that's so good to know. Now, I will say, like, side note on the internal exam, if you are a mom and that's something that freaks you out, I will 100%, I would put like money on it that your experience with a pelvic floor physical therapist as an adult would be 100 million times more gentle than your gyno appointment. At least that's what my experience has been. I'm just saying, not hating on any doctors or anything like that, but I think it's important for them to not be afraid of that, but also to know that that's not something you have to even think about for your kiddo.
I will say there is a similarity between adult pelvic health and pediatric pelvic health, in that we approach things with the same idea that we want to make sure that your mental state and your whole body state is in a state to receive the therapy that we want to do. So in an OB's office, their job is to assess and do this one specific task, right? Mm-hmm. But if you are in for adult pelvic health therapy, we want to talk about, do you have any fears that are creeping up right now as we're approaching this therapy? And if you do, then let's talk about that, because that's affecting your muscle function. So we do talk a lot about. Yeah.
How can you can't relax if you're like, don't touch me.
I'm freaked out. So there's absolutely an overlap with that, of acknowledging helping your child or helping the adult patient be in an emotional state to be able to then move to the next step, which is the actual treatment that we're trying to help them work through.
Yeah. And I think too, like, when parents are frustrated, kids obviously not having a great experience, and then the parents are frustrated because they're also not having a great experience, and that frustration can build, and then it's hard to relax when there's just general discomfort all around, and everyone's obviously trying their best, and no shame or guilt with the frustration. It should just honestly, a lot of times, the experience. Our mental state does control the tension in our muscles. And if we're stressed out, we've had trauma of any kind, things like that can absolutely affect our pelvic floor and our other muscles. And so just knowing that, okay, my kid is going to go to pelvic floor physical therapy, it's going to be fun, gentle, and go at the pace that we're comfortable with. And if at any point we're uncomfortable or unsure of anything, like, this is a safe place for you to express your concerns or questions, or ask, do a timeout at any time. And even giving the kiddo the control to have breaks and timeouts, and know that you're going at the child's pace too, not just the parent's pace.
100%. One of my favorite things about having my own practice instead of working for someone else is that I have essentially mandated. I mean, I invite the family in, but every family is coming into the office during the entirety of our session together, whether that's virtual or in person. And so the parent, the family member is getting 100% of the session in terms of they're observing everything, they're seeing everything that we're doing, and they know exactly what they're going to be carrying over outside of the session, because that's where you find the most growth. If you are seeing unconstipated kids for services once every week or every 2 weeks, and that's all you're doing, then you're not going to find improvement. And in other locations, that's what you see. You see a child go back for 55 minutes of the session, and then you see a recap with the parent for 5 minutes. And how is the family member supposed to carry out what is going to help them outside of the session with a 5-minute summary? Sorry, this is just a little soapbox of mine, but parent education, family education, and talking about it is so important.
It's so important too. I mean, they're the ones, with holding their kid's hand, trying to distract their kid. Like, if your kiddo struggles with relaxing their pelvic floor, like going potty, like physically looks uncomfortable for them. I mean, I might be out in left field here, but like, for me, even as an adult, learning how to relax my pelvic floor to work on my own personal pelvic floor issues and urinary incontinence, which is like basically peeing my pants, or like getting home and having to run to the bathroom because I'm straight up going to pee my pants. Things like that. And just being an intense type A human being, like, I really like tighten up, right? And so relaxing my pelvic floor for literally a, hopefully cognitively developed adult woman has been so hard. And so I imagine too, being a parent, right, who's maybe never heard of pelvic floor or even thinking about the fact that there's muscles controlling this experience for their child, trying to, help them, distract them, get them to just like go to the bathroom without like a horrific experience. They're like, oh my God, like there is a huge, huge chunk of this puzzle that I'm missing. And then they find you and they're like, Caitlin, Dr. Keller, please help me help my kiddo. But I know your facility is in Houston. And I'm not in Houston, I'm actually in Milwaukee. Like, how can you teach me how to make this experience easier for my kiddo? I feel like they're like this trying to, go potty. What do you think could be going on, and how do I ask you about it?
Yeah. So first I want to acknowledge, I love that you are acknowledging your pelvic health journey. I think that that's great. It talks about how common it is, right? And so
Mhm.
I'm going to blow your brain a little bit. So I'm in pelvic health therapy myself, and I'm a pelvic floor physical therapist. So
I'm so proud
so
of you. That's so
yes,
good.
yes. So if there's a challenge, we work on it. And so I
Mhm.
have some challenges, so I'm working on it. So I just want to, I love on the fact that, you know, we're bringing to light that this type of therapy is super beneficial and available, but nobody really wants to talk about it.
And P.S., everyone who's out there being like, oh, it's a baby's fault, I don't have any kids. So you can have urinary, you can pee your pants and not have any kids to blame it on. And nope, it's just your muscles. Like they could
Yep.
be leaking because they're weak or they could be leaking because they're tight. And so you have to go to an expert to try to tease that out. Like that wasn't really something I could do on my own, even though I'm also a physical therapist. But I'm not a pelvic floor physical therapist. And also, there's more going on and stuff.
Yeah. And it's a
I
whole
need some
body
help.
experience, and you can't really, you can treat your own body to an extent, but sometimes we need a little help. And surprise, I do have one child, one living child, but he was born via cesarean, and I'm still in pelvic floor therapy. So there's a lot of misconception that it's only for people after vaginal birth, but that's
Mm.
also not true.
So little just
Um,
tidbits for the mamas here, just
yeah.
bonus tips.
Well, I feel very strongly about sharing information. And so if you ask me a question, I'm going to hone in on that question no matter the topic, whether it's relevant to unconstipated kids or not.
I love it. This is why you're my favorite.
Thanks. So let's see. Back to your question of how, if somebody's not in Houston, how can they seek out services? We do offer virtual coaching sessions. So this is a one-on-one experience with me or the other physical therapists that I have on staff who I've trained. And so what Unconstipated can do through this coaching service is just a video call, no matter where you are. So you can be in your house, in California, in New York, in Sweden, and we can have a conversation about things that your child is struggling with, things that you've tried to implement, what's worked and what has not worked. And then we can figure out a plan of, hey, what are the priority items? What do we feel like we can really tackle and implement? And then we're going to talk about specific action steps the family member can take through verbal guidance, through some guidance that we might send you with written resources and PDFs and handouts that we have. If you feel like none of these things really get to the level that you would like, that if you really want some more one-on-one conversation with me in person, and Houston is a feasible trip for you. So that's something that I do offer as well as an additional step for out of Houston people, families.
Awesome. And how long are the intensives usually? Are they a full week?
So that pricing is out for one evaluation and two follow-up sessions. So typically
Okay.
we start at 3 days, but we can increase the number of sessions in a day or the number of days.
Perfect. Perfect. That's so good. I think this is another thing that we're seeing more and more of in the physical therapy world, especially from business owners or physical therapists who own their own business. So they have a little bit more freedom, which is essentially getting parents a little bit quicker results, but you get a little bit more therapy in a shorter period of time, and you really are able to have more face time with the therapist, and then you're able to see that progress, but also ask those questions that you then think of after that first visit, but maybe forget by the time that next week comes around. So things like that
Mm-hmm.
make that experience maybe a little bit more personalized, customized, a little bit higher end, if you will.
Yes, the learning curve for this is absolutely much steeper than most other options.
So you should bring your coffee. Do you allow
Yes.
parents to drink coffee in your facility?
As long as I'm also able to drink mine.
Perfect. I think all of those are really good things to share with families because a lot of times, due to limitations in the medical model, we've been forced to cram a lot into a very short period of time. And that's not what we're doing here. We've gone rogue. Me and
Yes.
Caitlin, we have gone rogue, and we are here to serve families in a gentle, calm, really heartfelt way to get you across that bridge to really have a good, gentle bathroom experience or gross motor experience or both. There are therapists out there that are able to provide that experience for you.
Yes, absolutely. I love that
Awesome.
we're both that type of therapist.
Just like, no, can't ever go back.
No. Nope.
Awesome. Well, Caitlin, is there anything else you want the world of YouTube to know about your company, Unconstipated Kids, where you're located in Houston, Texas, the virtual consults? I mean, girl, you're doing it all. YouTube channel, she is on Instagram. I will link everything that Caitlin is doing in the description. So if you guys have made it to the end of this interview, we're having too much fun.
I could talk about this forever. So,
well, we're going to be in trouble then.
Thanks so much for having me. I appreciate being able to talk about this. And I hope that, one of my love in life is talking about this and sharing this with other families so that they know that this is a thing, that this is an option for them. So I appreciate the opportunity to be able to spread the word.
Absolutely. We are here to educate parents, to help them make good, proactive choices for their families, and to help kids move with confidence and ease. And that includes their bathroom experiences, not just
100%.
movement.
Yes.
Oh my God. Well, this has been so much fun. We're going to have to get you back on the channel for sure. Everyone, make sure you check Caitlin out. And again, all of those links will be in the description.
Thanks, Lauren.